Now on Talking Solutions, we're going to talk about a drug that's going to help with a problem we all need to be more aware of. Welcoming back into our studio, Bob Vickrey from West Care.
Thank you, Terry. It's a pleasure to be back. Thanks for having us.
Happy to do it. We also have Dan Heller, a pharmacist with Smith's. A few weeks ago, we did a show on heroin addiction in Southern Nevada, trying to get the word out and shine a light on the fact that this is a bigger problem than people realize. And also to understand it's our neighbors, our coworkers. It's the parents of kids in our midst. It is the problem of opiate addiction. And the group that we interviewed a few weeks back was There's No Hero in Heroin. Mm-hmm. One of the things that Joe Engel, who is the head of that group, shared with us is that opiates,
oxycodone, hydrocodone,
those drugs, Dan, are chemically in your body the same thing as heroin.
Well, heroin has just some changes from the morphine structure, so very similar, just making it much more potent, and they all do the same thing. Heroin's just a very potent form of it, very addictive.
One of the things that was brought up in this other discussion about the heroin addiction, we've got an epidemic in our midst, so we all need to set up and be aware and know what we can do to help. They were saying that a lot of times the problem is somebody maybe gets an injury, and the doctor prescribes a potent painkiller to deal with that, like an oxycodone or one of the variations, Dan, that you mentioned. Then down the road, they're addicted. Their body now needs this drug. Well, they either don't have the prescription available for them anymore because those things are being cracked down on, if I understand correctly. People like Governor Sandoval said, we've got a problem. We need to restrict and make access to the drug not as simple, and too many prescriptions are being written. So somebody has this addiction now, but they can't get the drug. From what I was told when Joe Engel was in, he said, heroin is out there, it's more available, and it's cheaper.
And believe it or not, in the last 5 years, we've actually seen a decline in the actual prescription overdoses, but because of the access of heroin and it's cheaper, we've seen that still incline, and so that's becoming a little bit of a danger and concern because we are doing what we can in the health side, controlling that outflow, and there's still more to go there, but that still leaves that street drug out there that can do the same kind of damage.
Right. That's a valid point. And Governor Sandoval and his wife, I might add, the First Lady, are powerful advocates for addressing this epidemic of opioid overdose and opioid addiction. The heroin that these folks are now turning to your point, Terry, accurate, is not the heroin of the 70s. The heroin that they're turning now is black tar heroin, which I might add, I'm sure Joe mentioned this, runs about $10 a bag on the street. Compare that with the price of a pharmaceutical pill, legally or illegally. And then that heroin is often now being cut with even more powerful painkillers, which I'm sure Dan will mention as well. Things like fentanyl. And in the East, we're seeing even more powerful synthetic called carfentanil. And these are extremely dangerous additives that are going into the heroin mix on the street. And that's one of the reasons that accounts for the spike in mortality that we're seeing in the overdose epidemic. And it is extreme, and it's real, and it's out there.
And that's one of the things we're addressing today on Talking Solutions. The opiate addiction problem, the spillover into heroin, the really potent drug that's out on the streets that's very available, that is very inexpensive. We're clamping down on the prescription drugs, but people who are already addicted, and they're like, my body needs this. Yes. Bob Vickrey is with West Care. You certainly understand addiction and recovery, and you aid people in your role with West Care now, but your life has truly been impacted by addiction.
Yeah, there's no doubt about it. I'm a walking, breathing, living example of the cycles of addiction, and it's not an isolated incident. It's never a one-person incident. It's a family disease. And my brief bio is really simple and to the point. You know, I was raised in Las Vegas, had every opportunity of anybody that grew up in this community. I had the best job opportunities, a good education, a good home, and I found heroin in the 70s. Doesn't matter how I found it. Maybe I was looking for it or it found me, who cares? But once I found it, it got a hold of me really quickly, and it took me down extremely quickly. This was Mexican heroin, brown heroin of the 70s, known as the rock star drug back then. So many rock stars were dying of it. And the wonderful news for me is I found a way out of addiction and all the things that go with that: homelessness, petty crime, hopelessness, helplessness. West Care saved my life. It intervened with me at a time in my very early 20s. It got me back on my feet, and I've had a wonderful life of recovery, which is very important to recover from the disease of addiction. Now, I have a family of my own, and just a couple of years ago, my daughter, Sierra, then 19 years old, had left a treatment center in Mesa, Arizona with another resident of that treatment center. They went and found heroin on the streets from somebody they had never met before. And within 20 minutes, my daughter was unresponsive on the streets of Mesa, Arizona with a heroin overdose. And to this day, I am so very grateful that the paramedics that arrived in time to revived her with Narcan, which I know Dan is going to talk about. Thank God for that, because there's just no question about it. My daughter would be lost to me like so many other families out there, families that have lost their children to the overdose of opioid. We need these life-saving drugs out there. So I can say today, and my daughter doesn't mind me sharing this with the world, she has a year and a half of sobriety. She's a lucky person, and thank goodness we have West Cares in the world, and thank goodness that we have the life-saving drugs that are out there to help save when they can be provided in a timely manner.
Wow. Everyone who I've met related to West Care over these past few years has such a passion for what you do. And a lot of the people inside West Care understand the stories from the inside out, helping people through this recovery process. You know, one of the things, Bob, that we discussed here recently concerning the heroin epidemic that we have in our midst in Southern Nevada is the fact that if we could do anything, removing the stigma of long-term recovery was addressed with me, that we need to be aware of it, understand that this is really affecting families in our midst.
Yes.
One of the things that came up during the discussion was if you've got, for instance, a child with a heroin addiction, that your neighbors aren't bringing casseroles to your door. In comparison, let's say you have a child who has an illness, a cancer, something chronic. We'll get a fundraiser going. But when it comes to this kind of addiction, there still seems to be such a dark cloud. And what we need to do is be supportive, and that we need to celebrate the people who are in long-term recovery, overcoming it, and recognize the people who are succeeding.
Yes, very well said. And it takes a community. No part of this issue that we're discussing today is singular or isolated. As a community, we have to come together and put the light on what you just talked about, that we have an epidemic out there. I have stats that will go on forever. 35% of our high school students last year reported that they used prescription drugs without a prescription. There was no prescription involved, but they used a painkiller to get high. And that's the youth of our community. And youth or adult families are affected by this epidemic. And the more education and prevention that we can put into the equation, the brighter future we can provide. We're seeing a mortality rate we've never seen with any type of disease out there. And addiction is at the forefront. You know, right now, Governor Sandoval, through his work, he's trying to steer legislation that will help shed an even brighter light on this stigma and try to get more people into the programs that they need in order to address the problem. And we need all agencies, not just WestCare, to be involved in how we bring people through the assessment process. We talked the last time I was with you, Terry, about our community triage center. That is a gateway for everything that's happening in our community concerning addiction, particularly the opioid. Our diagnosed opioid folks that we serve at that one facility, we do about 500 folks coming through the door for assessment there and triage. They now identify in 2015 about 24% said opioid is a drug that I would prefer to use, heroin or otherwise, on the street. In 2016, it went to 74%. You can't deny those statistics. It's out there, and it's affecting so many people. So we need prevention, we need education, we need treatment, and we need folks like the state of Nevada to get behind us, the pharmaceutical industry, I know Dan will talk about today. We need our educators and our lawmakers. Everybody needs to be a part of it.
We got to understand that we've got a problem. We've got to get the word out there, and that's what we're trying to do with Talking Solutions. We are so thankful that you've got WestCare, people like yourself who are there, who understand when people come to you that there is someplace they can go. There is someone who understands, can talk to them, and can show them the way to recovery.
Yes.
Dan Heller with Smith's Pharmacy. There's a drug out there available for families and individuals who are looking to be prepared when they've got someone in their midst who is in that addiction phase and trying to come through it or out of it or whatever the situation is. But there is now a generic drug that can help us in those times of crisis.
Exactly. The state of Nevada put in place some regulations that did a few things on prescribing habits and a few things that pharmacies need to do in monitoring prescription use for opioids. But also one of those regulations that was put into place last year was giving pharmacies the authority to furnish Naloxone, which is the opioid overdose fighting drug. It reverses everything that an overdose would do. And after meeting certain guidelines, one of my functions is to train all of our pharmacy staff and pharmacists on the appropriate use and knowing what they want to do for educating the patients that come and ask for it, understanding the counseling points that need to be put in place for how to use it, and understanding the signs and symptoms of overdose and such, so we can feel confident in what we're doing when we're counseling someone that picks up naloxone. That's now all in place. All of our pharmacies are prepared here in the state, and not just singling out Smith's alone. That regulation goes across the board for every pharmacy in the state if they're ready, meeting all the requirements. But we are in place and ready to go for all of our Smith's pharmacies. So the products are out there. There's 2 actual brand name naloxone products that are in place that are actually approved for reversing an overdose. One of them is Evzio. It's a injectable. And the other is Narcan, which Bob brought up earlier, a nasal spray. There's quite a big variation in cost there and things like that. But insurance, from what I've seen so far in the early part of this year, have been very good at covering product for patients that are asking for it, or for loved ones that are asking for their friends or loved ones and spouses and so on. But there's also a couple other products out there as well. Naloxone that comes in an injectable form that can be converted to a nasal spray. It offers an option for those who may not be able to afford, if they don't have insurance, the higher costs of Narcan and Evzio. That's probably our third choice, and we're ready to show someone how to use that product as well if they have a loved one they're caring for and are worried about. And then there's a straight injection naloxone form, which is one that most people are not comfortable with. Innocent bystanders have to, draw up injection out into a syringe and try to inject somebody. And that's different from what I mentioned with Evzio, which was an injection form, but it's an auto injector, which talks you through the whole process. So it's a great product. It's just a little spendy right now.
Yeah, it's more expensive.
They're there. So anyone out there who is concerned about someone they love, a friend, a family member, can walk to the pharmacy up to the normal drop-off window as if they were a prescription and saying, I'm interested in getting naloxone. What's the process? And that's all they have to say. And from there, our technicians or pharmacists will say, okay, we've got a few options here. Let's take a look at what would work best for you, what you want to have on hand. Typically, all the products come with 2 doses because it's a very short-acting drug. It only works from 30 minutes to maybe 60 minutes, maybe a little longer, depending on the person. So that can wear off before the actual effects of an opiate. Hopefully, 911 has been called and emergency services can come along too once we realize someone's having an overdose. But there's always going to be 2 doses dispensed so that it can be re-administered if we feel the first one isn't working or if it's wearing off after that 30 minutes to hour and no help is coming. And Bob made a test to this as well, in that people are afraid to call the police. They don't want to call 911. They're worried they're going to get in trouble for whatever drug use they're having, and not realizing what they're doing, they're going to let somebody die because of that. So in that situation, obviously naloxone can play a big role there, and just a great product. And for those who wonder, well, what about the effects of naloxone? It's about one of the cleanest medications that I've seen. I mean, it doesn't have other effects on the body. It just replaces what an opiate or a morphine or a heroin or an oxycodone does in binding in our body, and it just moves it aside and says, I'm going to take over and then reverse the effects.
Yes.
There is some concerns in that someone who has a high dependence could go into withdrawal effects. That can be a concern, but that would never trump the effect of saving someone's life. So
saving lives is the most important thing, and the fear of calling 911 or the fear of bringing it to light, saving a life trumps that every time.
Agreed.
And I think it should be mentioned, I'm forgetting the actual terminology for it, but the innocent bystander, the Good Samaritan law that was also put into place. You can call, you can be involved in it or not involved. You're not liable for anything that's going on in that situation. So everybody should know that in our state. Just save somebody's life if you see it happening.
We're talking about an addiction crisis in our midst here in Southern Nevada. We've got Bob Vickrey with us from WestCare and also Dan Heller, pharmacist with Smith's. And we're talking about things that could save the life of someone you care about. We need to bring this opiate crisis out of the shadows and also give our support to the families and the individuals who are going through this horrible situation. Not be judgmental and remove the stigma and celebrate the people who are trying to get through this.
And I was just going to say, in terms of what you're talking about with judgmental, it's one of the approaches we did talk about when all of our pharmacists got together and we had our educational sessions about the sensitivity of the nature of people coming in and asking for this, and understanding about that privacy and fear of even saying, well, I'm going to be tied with a stigma. And it's just an understanding that that's not the case at all. And you just feel confident in saying, just have a product like that on hand. Go to the pharmacy, get it if you think someone may need it someday, because you don't get a second chance sometimes.
Yeah, and I'll jump in on that because all you have to do is pick up a paper for those that read a newspaper these days, or just listen to the streaming media about how big the problem of addiction is in the United States today. It's like nothing we've ever seen. And what I'm hopeful for is that when we're at the table and we're talking about how do we save lives through naloxone and what that can do to bring a person back, and then once we have a person and we have the opportunity to change lives, then how do we bring all of the stakeholders together to do that? I'm very hopeful that the folks that I talk to in the community almost every day about what are we doing about it, we're looking at a holistic approach. And being a guy that kind of went through the ringer here, there was a time when most people said the addict, quote unquote, it's a moral issue. If they didn't want to do drugs, then they should just stop.
It's not that easy.
Just say no. Wrong.
Yeah, I remember that in the 80s.
Right.
Just
wrong.
say no.
Wrong approach. The Medical Association, we all know, identifies addiction as a disease. It's a physiological disease, and we have to address it as such. And it's mind, body, spirit. And in my early days of trying to figure out how to get back into the mainstream and not live the life that I used to, thank God I found recovery, 12-step recovery. And for many years, I thought 12-step recovery was the only way anybody could live and never do drugs. But I'm here to tell you that we have to have a much broader, open-minded outlook on this. It's a very holistic issue. And there are drugs out there that will help manage a person's withdrawal as they come through the withdrawal process and help gradually taper them off any dependence of any drug. So total abstinence is not always. We need to have everybody at the table. And we know that there's a spiritual aspect that often people don't like the way they feel, so they find something to help them feel differently. They may have a spiritual malady. There's folks out there that have been through trauma that need to have mental health services to help them overcome trauma in their life. So to just say stop, we know that that's not the way. It's not going to change. So I'm hopeful because now I hear all of our community partners coming to the table and saying things like, we have to treat this as a holistic issue, and we have to look at the physical health of the individual. We have to look at the mental health of the individual. And in that, we treat the addiction. I think we're making progress, and I'm very hopeful for some of the projects that are coming online now to help us deal with our at-risk population.
That's what we need, just a sign of hope to see that we are having people who are successfully coming through. Bob, I wonder, once you are in long-term recovery, do you ever officially end that, or is it a lifelong, ongoing every day? I'm in recovery today. I'm proud. I'm doing great.
Yeah. I think you just nailed it. It is definitely about today. It is a journey. I'm sure you've heard that, not to be cliche as share, but it is a journey and it's an educational. We always grow. Hopefully we grow into the better. We grow into doing something a little better today than we did yesterday. And if I know one thing about recovery, that's the foundation of recovery. There's never a graduation. Again, things we learn along the way. Many years ago, they used to give somebody a diploma and say, you've graduated from your treatment program, now go have a wonderful life.
Just dump them out the door and hope they make it.
We know that that's not what happens. So we have a multitude of recovery programs out there, 12-step, that address all kinds of maladies in life. So to answer your question, thank goodness we have a design for living in recovery that allows us to always be able to not get back into that stinking thinking or hang out with the people that we used to and think it's going to be different. So we have a way to live that always encourages us to live in the best possible way we can as just a human being. What a wonderful concept.
Thankful for every day.
Yes, very thankful. And again, through education, we have to allow people to find their own way with guidance and with the professional help, of course, that they can find their way out of the darkness of addiction. And sometimes it may not be just going to a 12-step meeting. We have to keep other options on the table. Our community of churches, for example, in our valley have Celebrate Recovery. And some people have an issue with going to a 12-step meeting and having the God of their understanding identified as a higher power. That's opened the doors for millions of people to recover, but then there's those that want to stay close to their own particular brand of faith. And in that we have Celebrate Recovery where they can stay sober using the church. And we have other programs out there that allow people to be agnostic. It's all about removing barriers and getting people into healthy, holistic living. And that's what WestCare stands behind too. That's always been our approach. Where they're at is where we want to meet them and meet their needs. It does take a community and it takes an open mind.
The problem of addiction, a lot of the people who are listening to our conversation have these issues. somewhere in their world, what's their first step?
Yes. Crisis is usually a part of addiction. And as a treatment provider, I always want to let the whole world know that we have facilities that will take people exactly as they are, wherever they're at, and immediately address whatever the need is. One of those facilities is the Las Vegas Community Triage Center. We're the only nonprofit in the state of Nevada that provides crisis management, medical managed withdrawal. And that's located downtown at Maryland and Stewart. If you can't get somebody to take you there, walk there, but get to a door where you can get immediate assistance and relief for the crisis that you're in. And the phone number there is 702-385-3330. And that's a critical number. Hang on to that, because there's folks there, trained professionals, medical, psychiatric help, and other professional caregivers that will take a person immediately, get them into a very safe environment, and treat their immediate need.
We will have that number and all the links on our Talking Solutions Facebook page, along with the podcast of the interview. Bob Vickrey with us from West Care. Also, Dan Heller from Smith's Pharmacy. We're talking about the addiction epidemic. We know a lot of people are affected by this, and the drug that is available to help save people's lives, literally, is now much more available thanks to, well, I guess it was a Senate bill.
Yeah, Senate bill put into place with a number of other stipulations, but Naloxone is now available just walking into your pharmacy. And you don't have to know that name and remember it either. You can just say, I need the drug to reverse an overdose, and everyone will know what you're talking about.
Every time you go get a prescription, they always say, would you like to consult with a pharmacist? In this case, all of the Smith's pharmacists have been trained on gentle, compassionate understanding for that individual they're talking to, letting them know how to use the drug.
We know how it works as pharmacists, but it then comes down to we have to be able to convey the message to who's ever picking it up and understanding how they're going to use it for that potential end user. And if it is that person that has the higher doses of oxycodone or opiates of some type, the basic understanding when we're talking to them is who's in your household, because that's who we want to counsel. If something happens to you, we need someone there to give you this dose. And if that person can't come here with strong message to the person picking up, you need to make sure everyone in your house knows how to use this, or you need to make sure your friends know how to use this product. They're pretty simple, but they need to know it's there. It's wasted if you have an overdose and you didn't get a chance to use it. And it wouldn't hurt if you want to get this product to know what some of those risk factors are. You need to know, is my loved one on high doses of opiates, or do I suspect they're using street drugs like heroin or other things? Are they on combination medications, or what we call polypharmacy, where they're on an opiate of some type and they're on a muscle relaxant, or they're on something called benzodiazepines like Xanax or Valium, things like that? And do they have a history of overdose? Do they have mental illness that's tied in a lot to abuse potential? So a lot of those things you just have to take into account and say, they've got all these risk factors. There shouldn't be any reason why we're not getting this. And then that was another issue we talked about when we got our pharmacists together. It's like, it's one thing to have it and dispense it to someone coming to us, but we need to reassess the prescriptions going out our door and make sure that this is a person that should have this on hand with their family members or friends to know how to use it, because they are at a higher risk for whatever pain issues they're dealing with. That's how we're approaching it. We're going to try to get it into the hands of people who are at risk.
Talking about our epidemic of addiction to opiates and heroin here in Southern Nevada, that's the dark part. But the brighter side is there are people you can go to. There are things that you can access, and understanding individuals just a call away. The most important thing is that we make that move.
And we're poised to help. We're not the only agency in town. We're the largest. We're also in 19 states doing the same work. And what we're talking about today is not central to Nevada. We're fourth in the nation for the highest mortality rate for overdose. But that just speaks to the larger problem that's happening everywhere. And to Dan's point, there's all kinds of ideas about when you're in the midst of crisis and addiction, finding a way out. I don't know how to live without this. There's not just one solution. There's medicated management for withdrawal, and there's medicated management for treatment. Folks can be tapered off these things. So there's not the stigma, oh my gosh, I got to go to one of those detox places and I got to be miserable and be in pain. How in the heck am I ever going to do that? There's professionals here, and West Care is among those professionals, that can take the individual that's hurting and bring them into a safe, secure environment and help them begin to find a way out. We use folks that do case management services and peer-supported services that help guide people through every step of the process to get them just to where they need. And the state of Nevada, the people people that are pretty smart about all of this stuff. The one thing that everybody's in agreement with is we have to treat it as a holistic issue. WestCare is poised now to be part of a SAMHSA grant for what is known as CCBHC, that's Certified Community Behavioral Health Clinics. We're one of 8 states that's been awarded the grant to facilitate this process, and it's a very important process to partner with all of the relevant stakeholders, the mental health professionals in the community, folks that can help us get people that we serve into housing to treat the medical aspect of addiction, to bring in peer-supported specialists that have been there and they know what it's like to go through withdrawal, and they can help guide that person into a life of recovery. We're very honored to be spotlighted as the agency to carry this forward, but it's where we're going. It's no longer the days we'll go detox and then get on with your life. Those days are gone. We have to guide the person all the way through, that classic continuum of care. And not to get on a soapbox about it, I can, but at one time our emergency rooms were so filled with people seeking immediate service in the crisis of withdrawal and addiction. Places like WestCare were needed to try to stop the overflow of folks that wind up in the highest system of care, an emergency room, in order to get help because they're in crisis with drug addiction. Now everybody's coming to the table to address the issue, and to your point, Terry, help is only a phone call away. We're one phone call, but there's many phone calls you can make. One of the things that I'm very proud of as a person that was raised here in Las Vegas is that WestCare is not only the largest provider for the services that we have, but we've been in the Valley for 40 years. We're the longest treatment provider. We've never turned a person away for lack of resources or ability to pay. So any person that comes to our doors today, as it has been all of these decades, regardless of their ability to pay, we're going to make sure that they get what they need. Go to westcare.com. We can not only find out about the multitude of services that WestCare provides in our community and other communities, but we can find other resources and mental health services and things that are really vital. Folks are looking for answers out there. I just encourage folks, don't wait until that terrible moment when a parent finds a daughter or a son beyond help in a bathroom, or a paramedic has to respond to somebody on the street that's so far gone they can't bring them back.
Awareness is so important. Bob, you've been with us before on Talking Solutions. We always ask, what can we do to help you?
We have Nevada's Big Give Day that's coming up. WestCare will definitely be part of that, and that's a wonderful opportunity to give back. I always give back on that day as well, not only to WestCare, but other worthwhile agencies and providers in our community. So look for that opportunity, and thank you for asking that question.
Not a problem. We also have Dan Heller in from Smith's Pharmacies. Dan, same question. What can we do to help you?
I was thinking about that when you asked Bob. It's just keeping the message out there of what's available. And there is another big event besides the Big Give coming up April 29th that happens couple times, 3 times a year, drug take-back days. And so often we have a number of prescriptions that are opiates, pain relievers, whatever it is, that it's in the medicine cabinets. And it's usually those that might make it into the street because teenagers could get their hands on it and it gets out there and gets used. That starts that addiction process. We can stop a lot of that before it even gets started. Those drug take-back days are big. Pay attention to that. Next one is April 29th. And they're always like from 10 a.m. to 2 p.m. Last year, we had them in our Smith's parking lots here in the city and up in Reno. And I'm not sure that will be locations this year, but you can always drop off your medications at police metro substations.
Yeah. Mm-hmm.
They have the drop-offs. Don't leave them around the house. Don't think, I might need this later. Just get any narcotics, get your controlled substances out of the house and disposed of properly too for the environment, and so that no one gets them for the wrong potential use.
Don't flush them down the toilet and have it end up in Lake Mead. We don't need that. Dan, that's good to know. We'll get the word out to let people know that Naloxone, am I saying it right?
Yeah, Naloxone. Naloxone.
A very important drug.
Life-saving.
Might add in 2 to 3 minutes. It's that quick.
It's available. We'll get the word out on that. And also the drug take-back day. Mm-hmm. It's springtime. We should all be cleaning out our stuff, right? Clean out our medicine cabinet. That's a great idea. Especially knowing, Bob, that you have the statistics of how many of our high school kids are admitting openly they take prescription drugs that are not theirs.
Yes. And I'm really glad you mentioned that maybe as a final plea. It's a very important message really to the parents in our valley and everywhere. There's just no doubt that the prescription part of this terrible cycle of addiction often starts in the home with a young person taking prescription prescriptions that aren't prescribed to them. We know that. And to the parents out there, if they can keep the ever watchful eye when behaviors start to change, there's one thing that is consistent with any form of addiction: behaviors will begin to change. And as a dad that went through it with my own daughter, I cannot turn a blind eye to that. It might be a number of things might come into our minds as parents. Maybe I'm not seeing what I think I see. Maybe it's not that serious. Who knows? But the bottom line is, children die, as Joe Engel attested to, because of the overdose factor out there. And that factor often begins in a medicine cabinet. And so I urge every parent, vigilance is the key. When behaviors change, something's out of order, address it immediately, even if it doesn't feel comfortable to do so. And maybe you're wrong, but if you're wrong, it's okay.
It's all right to care so much that you check into this for your child.
Yes.
We've got a good answer to start turning the tide on the addiction problem that is epidemic, but we've got some answers. So glad to invite you back in, Bob Vickrey from West Care.
Thank you.
And Dan Heller from Smith's Pharmacies. Great information. Thank you so much for joining us today on Talking Solutions.